Thank you. Good morning to everybody. First of all, I would like to thank the Sri Lanka Association for Child Development for inviting me for this important workshop. So then, so I just talk about the current status of autism in Sri Lanka on the health aspect. I know this will be linked with my colleague Dr. Saragala's presentation as well as Dr. Kamalani's thing. If there is any overlapping, please pardon me because it's, I think it cannot, is it even overlapping? It's okay, I think, because with the services we need to start. And I'll say that why we need services. I look at in the parents' vision and child's right vision, so what they expect. So we have to make the services available to suit both of them, and not only to suit the health services. So then what, if the parents, what they expect from the government or health services. So if they have any illnesses or anything, so they need early diagnosis and screening. Then what they need after that? Appropriate evidence-based early intervention. This should be not on faith basis, it's evidence-based, that according to the evidence, that what are the latest evidence, they need the early intervention and a preschool education. And so I'll explain a little later what will happen to the parents when they diagnose the child is having a neurodevelopmental disorder. And then they just feel like they have failed in exam. And then they definitely need for them, they need adequate counseling for parents to understand the condition and accept the condition and to live with it to the lifelong. So that's again important. Then you have to transfer that from the health services to education, and then you have to work in combined. So the proper education. Proper education means evidence-based education technologies has to be practiced, not to just to have a daycare center in a school. And then the schools. Then transition plans from school to vocational training, so that everyone cannot be an electrical engineer or a computer engineer. So then they need the vocational training. And integrated employment, residential facilities for maybe not for all, maybe for the needy, secure future, and protection for child abuse. They are more vulnerable for child abuse. And a social security system to support the parents. And I think this is what entirely that they need in a parent's perspective and also the child's right perspective. And then, so in each sector, you need the favorable policies and strategies. So we know that we talk about now that the UN, they have a resolution, and the WHO, they have now, WHO draft 2013, they had the resolution, and then that means that we have understood this as a public health problem. So then, if you look at this, if you put it in a diagram, so in a child with autism, if you think it's in a center, the family is surrounding that, and then you need this integrated services, what I mentioned, with the favorable policies and legislation. So what we need to is the goal plan. So then for two colleagues from Autism Speaks, I'll just put few about the background of Sri Lankan situation. So we know that, I think everyone knows that we are a small island, and then population is 20.3, and we have passed our survival states now, because it's our mortality in a maternal or a newborn or infant or child mortality is very low, and then and we have developed in that aspect, and we have a free health services. That's I think the unique feature, that we no user fees in our health services. Anyone can walk into the health service, and then you can even get a very complicated neurosurgery or a cardiac bypass free of charge. Okay, and then free education. My education up to the consultant is free, borne by the government. So that's why we are having the very high literacy rates. And then our per capita income, we have proven to the world money is not everything. And so we have achieved this thing with a very little per capita income. So something I think within the management or something we have achieved this because per capita income is I think compared to the developed country we are very, very good. And the government expenditure on health, if you look at as a health expenditure, is 1.4%. It's not that high because we are delivering very good integrated packages. And then health is also in other policies. That may be the reason that we could have achieved with this little per capita, the allocation. So if you look at, I think Dr. Kalagal will expand more on this. I just want to show that. So our health system is not scattered. So it's really, we have a very good organizational structure for the Ministry of Health. We have administrative structure separate in the left-hand side, and then the implementing structure, curative and preventive. So it's quite well organized service delivery model is available for our health system. I think everyone knows that if you talk about the health system, you have 6 building blocks in the health system. So that is, if you want to achieve anything through the health system as outcome, so you need to address these 6 building blocks: service delivery, health information, medical products and technologies, health workforce, health financing, leadership and governance. If you look at these 6 building blocks, I think we are doing well. We cannot say we are 100%, but we are doing well. But when you come to autism, the picture is not that good. So that's why I think we are all here. So autism ASD service, if you look at it, we all know that it should be multidisciplinary. I think all the speakers talked about it. It's multidisciplinary, coordinated, and evidence-based teamwork. So if you think this has a gold stand, so we look at what are the services we have. So we first look at the positive development in the Ministry of Health rather than looking at the weaknesses on us. Then we work on this positive development. So the Ministry of Health has identified separate directorate for disability. So that's I think a very good movement because it's they have given the priority because it's a disability, you need separate focus. And then under the family health bureau is the focal point or the center for excellence for maternal and child health. They have identified separate unit for children with special needs with the national program manager. He is here, he will speak after me. And then that's again a very good development. Why? If you don't do planning, coordination, monitoring and evaluation in a national program, it's go here and there. So then the ministry has you mean identified so that you need a proper place to plan and organize and monitor and coordinate. But when you come to then I'll do that section by section in the diagnostic screening facilities and early intervention. So there's a long way to go. First thing I want to say that we have very few studies that Professor Anoma study, and then Dr. Kalagal is doing some pilot project. And then we don't have much data. So first, even to plan our services, we don't know much about it, how much the things are available. So then, in any national program, coverage should be nationwide. But if you look at our diagnostic and screening facilities, there are very good work happening in LRH. I know that Professor Pereira's unit, Dr. Vijayatunga's unit, and they are in the Kandisam area. Very good things happen in a few areas. But if you take the national-wide, look at the national-wide service availability, we have to say that we are very not developed. So few motivated psychiatrists and pediatricians started services in few selected tertiary institutions. Not only for early diagnosis and treatment, but even they have gone beyond that. I'll explain it later. So that's again a very good big area we need to be scaled up. And then there are 2 community pediatricians, again very important that our number of pediatricians I think in the country is 146. Out of them, 2 community pediatricians are there now. I think that now they have recognized community pediatrics. Dr. Deepa Samarage is here, she has done a lot of work on then pushing this I think community pediatrics. So this discipline will go on. And the important thing is, this is mainly how they come to these centers, even for these functioning few centers. self-referral most of the time, or referred by some. So there's no identified referral system. So the screening tools developed, and then we have piloting this project. Dr. Karagala will discuss about this in his presentation. Is on a phase of piloting. I think with using all internationally available tools, and then Professor Pereira, Dr. Jayatilake both involved, and then and there are a group of dedicated people, so they have adapted these tools. And this is the stage. I think there's a long way to go in this diagnostic screening facilities. But if you, so what are the positive things? So if you look at the psychiatric mental health services, you can see over the years how it has improved. So you mean that we have hope, now we have psychiatrist number is increasing and the more mental health number is increasing. So that you can see that from 2004 how 2011 our services has spread in the country. So earlier also I talked about this multidisciplinary. Then what about therapists? So we have all these categories: occupational therapist, speech therapist, physiotherapist. All these therapists are there. But we couldn't get the exact numbers. But there are throughout the country is working. But psychologists we don't have. But ministry has now created card for 27 psychologists and advertised the post now. And so important thing in this therapist, the pre-service curriculum has updated to include autism. I know in the OT curriculum is fully developed. So then there was a consultant hired by the World Health Organization. She works with our training schools, and their speech therapist also. The curriculum is very but what about their workload? So they are the only one who are appointed for the entire hospital. But very which way, I think they have to work with. But if you go to the other hospital in the periphery, they have to look after CVA patients, they have to look after all other the CNS patients, neurological patients, and this the priority and the time allocated for this autism is a big question mark. And I think the speech therapy card, then 27 posts still vacant, and the batch is now available. They just passed out. And then, but the problem here is mainly no coordinated service among therapists. And then, so we know that it's a multidisciplinary coordination. This has to go a long way. So I don't say that it's nothing there, but it has to go a long way. And then the early intervention and preschool services, this comes under the different ministry, Ministry of Women, Women Empowerment and Child Development. So we have preschool, chain of preschools, but this dedicated for autism service is, I can't even count in my fingers. So that's the important thing. But there's a huge potential here. So the preschool is there, then early intervention, how can we do? And then even in this, whatever the so-called good places, do they practice the evidence-based education interventions? That's the problem. So Aura is like I know that some technologies you can share with a lot of disabilities, but if you go to autism, there are specific things that if you don't do specifically that like this sensory integration. If the sensory integration is not there, most of the sensory issues are not addressed really, rather then these children are not available for learning. So then I think we are a long way to go. And the coordination between preschools and the health is quite minimum. I think Dr. Karagala will explain about in his project how he developed those things. And undergraduate and postgraduate medical training. I know that few medical faculties, this due respect to Madam, Professor Hemamali and then this Ragama unit, they have upgraded their curriculum for the medical training. And this disability unit in Ragam, they train male undergraduate as well as the postgraduate speech therapist. so their curriculum is quite updated. Then the post-basic training of pediatrics, which adequately included this component. I know it has gone to there, but I think in other areas you need to look into that. Then this is like in a curative health sector. But if you go to the preventive arm, I'm not going to talk a lot on this, but we have a very beautiful system. There's units. These units I have explained here under the Regional Director of Health and the MOH graduate training is throughout the country. Then Dr. Kalgal will explain more. So there's a huge potential here. That's how we can do the early screening and the follow-up. So other beautiful thing in this our program is life cycle approach. So you register these mothers when they get married. So when they get married, we register. So then this services is really going through the life cycle. So then I think he will explain more. There is a huge potential here. So each and every baby born under the care of public health midwives from 0 to 5 years. Then we have the school health services. We examine all the school children in grade C, you mean the 0, 1, 4 and 7. But no organized autism specific services yet. Huge potential for screening and early intervention. So I just plan for screening and early intervention. He will explain more about it. So I'll just explain about when your child is autistic, what will happen to the parents. Because in any service, if you ignore the parents, so you are lost in autism. Because in the first view, you go to the shock state. Then you go to anger, you don't know it soon. And then you get fear, what will happen in the future. And then you get resentment, and then worry, you are started worrying. And then you feel guilty if something has done me wrongly, that's why that child became dirty. And then you start screaming, and then ultimately profound sadness, and then acceptance. This is a long way to go. If you don't understand this process, and if you don't work in this process with the healthcare delivery system, or a school system, or a preschool system, if you don't understand them, you are a failure. So you are definitely a failure. So then, all these stages to come to the acceptance that mothers need, this stage, parents need high quality counseling services. So where you start services, then you need to plan about this also. So there are evidence that say they take time to heal and to understand and accept. But begin treatment for your child immediately. Starting the intervention is the best way to work through the acceptance of the diagnosis. If you don't have any intervention, so if you give the diagnosis, and then that's very, very extremely bad in public health. So on the parent training and support, I can say that no national-wide organized program, few existed motivated professionals. I can say that Professor Keleta was one of the leading one even, so who started these things, even from her out-of-pocket money. And then, so this is, parent association exists, but still need a lot of capacity building and coordination. So I know it's happening here and there. Now this, they have started in the leadership change Swarna, and then Professor Pereira, both they started this with Saman Mali, that all parent groups, but they need a lot of, but this is only Colombo, that how many, what are the other areas. In the parent support, so there's evidence says that parents enrolled in parent training program report that social support would like to reduce the stress. So parent, so this is, there are evidences on this, and then that is a good. Education I'm not going to touch because the Professor will talk about the education. But I like to say that one thing, the coordination between health and education, that's a huge gap to be bridged. That I need to say. And also evidence-based education. evidence-based education. These are the two things that I want to say, that not just a class and then in 48 children, then 5 autistic children just being in the in the class and doing some other things. So then that is again, I think that is good. Then vocational training. That's the Ministry of Youth Affairs and Skill Development. So and then very positive ministry. So now they have started this vocational training, but they need a lot of know-how. How to work with autistic kids, autistic adolescents or adults. So then if you don't have this, you cannot transfer this to the smooth transfer of society with skills is quite important, but this step might not happen. So I think this is again an area, so we have to help them because they are quite motivated, they are receptive, and then but they don't have the know-how. So it's again important. So then the positives and hurdles, if I fall back in 1995 to 2003, there are a lot of positive things happened. Why 1995? Because in my personal experience, in 1997, I got to know there's something called autism, but I have heard in my medical school a little vaguely. And then till that time, I think it has improved tremendously. Advocacy, awareness, commitment, motivation, and initiation of services has tremendously improved. That you have to accept. And it's not even talk in this term those days. And then now everyone knows, everyone talked, everyone committed. So there are few people, I think I'm not going to tell all the names, but everyone knows that in the country. And then, so be thankful, and then how we have come to this stage, but that's a long way to go. But there's a very big gap in the knowledge and skills or competencies, big room to improve. Even though you are committed, even though you are aware about it, so you are motivated, but you need a lot of skills and competencies to manage autistic kids. And then it's not like other illnesses and giving treatment or a pill or a thing. So this is very important. And another positive thing is political commitment. So we have to acknowledge that Cabinet Subcommittee with 3 ministries appointed by the President and plan developed by each ministry, and I think Dr. Kamalani will talk about it more. So in any public health program, so what are the principles? So you have to get the high coverage of effective evidence-based intervention. It's key to improve the health status. So in this program also same principle applies. So the coverage is important. So we have to expand. We have to expand throughout the country. This is a very, very big challenge we are having. Then the universal coverage is important. If you don't have the coverage, you don't see the outcome. And then equity. So you cannot have only few places. And then all the underprivileged group also. And the quality, then evidence comes there. If the coverage is not effective, if you don't practice the evidence-based interventions. So this is the public health principle at last I want to say. So this is not a rather negative, like not the negative way of putting it, that if the services are not available or substandard, parents feel more stressed and frustrated. Then this is itself. So this is, you can come to the stand. But if you don't have proper services, they get more frustrated. So then all the service providers who are planning services must take into this, into the in the planning phase. So we are, what's the good thing, we are committed to fight their future. So that's our positive thing. Thank you.